Welcome back to another episode of the Healthy Roots Podcast. I'm your host, Dr. Lake, and today we have an important topic to explore. We'll be delving into the medication known as Semaglutide, otherwise known as Ozempic or Wegovy, and its potential health benefits and also side effects. But more importantly, how you can naturally get these benefits without having to take on some of the risk of this medication. As always, we'll aim to provide you with valuable evidence-based information to help you make informed decisions about your health. Before we dive into today's topic, a quick reminder to our listeners that the information shared on this podcast is for educational purposes only, and it should not replace an individualized medical advice from your healthcare provider. Again, as always, consult your healthcare provider before making specific decisions on your health needs. So semaglutide is a very popular medication right now, and it's gained a lot of attention for its treatment of type 2 diabetes and for weight loss. It belongs to a class of drugs known as GLP-1 receptor agonist. These medications work by mimicking the action of a hormone called glucagon-like peptide 1, or GLP-1, in the body. And semaglutide in particular is found in medications like Ozempic. So let's talk about the positive benefits of a medication like semaglutide. So it's known for stimulating the release of insulin. And so if you don't know what insulin does, essentially what insulin's role is to manage your sugar in your blood. And so whenever we have a rise in sugar, your insulin should then be released from your pancreas and take that sugar and put it where it's supposed to go. It also releases glucagon, which is a hormone that raises your blood sugar levels by promoting the liver to release glucose. So semaglutide slows down the emptying of your stomach as well, which can help to prevent rapid blood sugar spikes after eating. Some individuals may experience a decrease in appetite while taking this medication, which can contribute to weight loss, particularly those who are overweight or obese. But let's talk about the potential side effects of semaglutide. It's important to note that obviously not everyone will experience the same side effects, but these are the ones that are most common. The common side effects that were noted during clinical trials were nausea, vomiting, diarrhea, abdominal pain, and decreased appetite. But it's worth noting that semaglutide is not usually associated with significant muscle loss. However, some studies have shown that participants who are taking this medication primarily lost muscle mass in comparison to fat loss. Now, this is actually more common across all forms of weight loss, just because whenever somebody is typically going on some kind of diet, they typically will cut their calories. Whenever you're cutting calories, you're essentially cutting energy. And so for somebody who's not replacing or adding into their regimen something like exercise, and they're simply just restricting calories, you're likely to lose not only weight through means of fat loss, but also muscle mass. So this is definitely the case when it comes to semaglutide. And you have to be careful to note that if you're just decreasing your appetite and affecting things like insulin and glucagon, you're not necessarily going to be losing the best form of weight. It often can come at a cost. And this is where people start to see additional side effects when taking medications like this. And so definitely keep that in consideration. And again, but while it's less common, it's also been noted that people have seen issues with pancreatitis and gallbladder issues, such as gallstones, have been noted. And also people have there's been some warnings on the box warnings that have indicated there was higher rates of thyroid cancer in the animal studies that they were doing on this medication. And so you definitely have to take that into consideration. Again, whenever your body is going through weight loss or you're restricting calories and it's not getting the nutrients or the nourishment that it needs, there are side effects to that, right? Like your body is then having to draw from other places. And your thyroid is one of those systems that it really gets the blame for a lot of the problems, when oftentimes there are things like inflammation, nutrient deficiencies, or high levels of stress. And that can then affect the thyroid a lot more and cause more of a hypothyroid state. So you have to be very mindful of this if you are just cutting calories and you're not replacing with, getting sufficient nutrients or ensuring that your body is getting the right levels of fat and protein, even the right levels of carbohydrates, because all these things are so vital for your metabolism, for your thyroid to function at a high level, and for it to convert T4 into T3 and to get that T3 into your cell for a metabolic effect. And so, again, we can't just cut calories. There's this term known as adaptive thermogenesis, where basically your body will slow things down. And this is also why there was some evidence that supported that people that were going through the potato famine, that the ones that survived this famine were actually ones that had a hypothyroid state, or the body was maybe inducing a hypothyroid state as a form of protection. So you definitely have to be careful with that. But now I want to kind of focus on some other perspectives here. So, I'm not a physician. So for people who don't know, I do not prescribe medications. I like to do lifestyle factors. I have a clinical doctorate in physiotherapy, but I have postdoctorate training, board certification in functional medicine. And so that's primarily where I get my skills and my training to help people. And I've been able to help thousands of people to this point do things naturally by focusing on lifestyle factors. So that's kind of where I reside when it comes to giving educational content, is really to try to focus on this alternative world of what it looks like to go at things from more of a natural perspective. Now, there was a video that came out that was from a couple conventional physicians. One of them is a board certified endocrinologist and obesity expert, and she promoted on this video, this podcast with Dr. Mike, that most people should that are obese should be on this medication, Ozempic. And so I want you to listen to that now and hear it for yourself.
You think that every patient should be on, that is classified as obese by the American medical standards, should be offered a medication?
I cannot say 100% of the patients that
Large
have obesity,
majority.
but the majority would benefit from the drug, yes.
That's scary, because then we're saying like a huge percentage of the United States should be on these medications. Have we gone that far?
I believe so. I mean, it's predicted that by 2030, half of the US population will have obesity. Half of worldwide also will have obesity in the next decade by the WHO. So I think we've lost the perspective around food, around portions, right? When you're on this medication, you really see things differently. It's like a blindfold was removed from your eyes.
So obviously, I think it's worth noting that I don't think this doctor has ill intentions to harm people. I think she's doing the best that she can with the information that she's been given and her training that she has. Now, again, as somebody who does not prescribe medications, I don't have the burden of having to consider what is best for a patient when it comes to whether or not they should do medications and or lifestyle factor modifications. I only look at it through this one lens of, hey, you've already been given medications to this point. Now you're looking for alternative options. And so what are the alternative options? Like, that's where I live, and that's where I like to help my clients. And that's where I think I provide the greatest benefit. Now, if somebody wants to go down the medication route and just take a pill for every ill, that is definitely, there are plenty of options out there to do that. But again, there are side effects to taking medications, just like there's side effects to sometimes not taking medications. It's not necessarily this or that. There is some level of neutrality here that we can kind of appreciate the fact that, we are blessed in a world where we have advancements in technology that allow us to do things and take things like medications or have certain surgeries. But there are also the other option of we can do that alongside with lifestyle modifications and or just do lifestyle modifications if that's what's best for you. And so listening to this doctor, she is promoting that, most people would benefit from a medication like Wegovy or Ozempic, and how that they would be beneficial if they are obese. And I can see where she's coming from, because if you are seeing a patient population that's coming into your office and they are following the standard American diet, and as a physician, you are not really trained in nutrition, you're not really trained in lifestyle factors, but you are trained in pharmaceuticals and surgery, it would be a very natural, confident response that you could give to somebody to say, hey, this medication will help you. This medication will help to suppress your appetite. It'll help you to lose weight. It'll help you to maybe even get off some other medications or help you to get more active. That is a good thing. Like, that is a very good thing for somebody to consider that as a potential viable options. However, if you are somebody who's like, hey, I want to know what I can do naturally to fix this. I want to know what I can prevent the progression, or how I can prevent the progression of diabetes. And again, depending on who you're talking to, and maybe this endocrinologist would even agree, a lot of them will say that once you're on these medications, you have to be on them for life. Again, as somebody who's worked with a couple thousand people at this point, I would disagree with that, as I've seen a lot of my clients get off medications and get off diabetes medication and get off thyroid medications. I've seen other alternative options. And so I tend to disagree with that, but it depends on the particular individual. But getting back to why somebody like this doctor would recommend this, it's a very good option. It's a very viable option from her perspective, because you have very little amount of time when somebody comes into your office. You have a lot of the pressures of insurance companies and proving why there should be a particular therapeutic intervention. And you just don't have the time or the resources to sit down and create a meal plan of somebody to walk them through, what triggers their immune system, what causes their inflammation, or why they're not detoxing from the liver, why they're having issues with appetite control, and all those different kinds of factors. And so if you're not adequately and sufficiently going through a patient record, or you don't have the proper time or amount of time to properly go through a solutions-based approach that is natural, then what else you can do but take a pill, and it's going to be more effective than doing nothing. So I definitely understand where she's coming from. This is not trying to bash endocrinologists. They are very intelligent, very wise. They have a lot of good skill sets, but they are not the end-all be-all when it comes to health and wellness. And I think this is something that people need to appreciate in healthcare, is that we have often, and even being trained, getting my doctorate, I was trained that anyone that goes outside conventional medicine typically is considered to be a bit of a quack. They're really practicing a lot of woo. They're not foundationally based in science. They're kind of all over the place, and you can't trust them, essentially. And in medicine, there's very much a hierarchy. There's a hierarchy of information that gets passed down. The senior doctor is the ultimate authority. Maybe the school that you go to is the ultimate authority, and they're always just passing down information. And so though a lot of healthcare practitioners or providers or doctors are being trained to be critical thinkers, I have seen that there is a lack of critical thinking when it comes to where is the source of information coming from. Because as I started to learn, going through my own health journey and experiencing the fact that I was having chronic pain and chronic fatigue, and I could not fix them myself, having this understanding of science and biology and chemistry and physiology, that I couldn't figure out what was going on with my own symptoms, I started to look elsewhere. I started to go outside of what I had been trained, and that's where I started to get into functional medicine, because functional medicine showed me that there are interconnected pieces that have caused and contributed to a lot of my problems that I was dealing with. And so once I started to see that, I started to apply the foundational principles of science that I learned in my undergraduate and doctorate training. And then I went further on and got postdoctorate training in functional medicine and was board certified in that, because I truly found that was a much better route than what I had done previously. So I think for a lot of people who are being challenged with this like maybe gaslighting to a certain extent, that if you're not a medical doctor, that you don't know anything. Like that's kind of that's what I face even now. It's like, well, your doctorate's not in endocrinology, or you're not an immunologist, or you're not, whatever. Like it's like you don't have a say. Like your opinion doesn't matter. And I think this is even worse when it comes to the patient. When the patient is faced with this same kind of approach or same kind of talking down to, it can start to lead to a lot of frustration and a lot of a lack of confidence, really, that the patient knows what's best for them. And I think this is something that we have to appreciate as healthcare practitioners, is that we have to appreciate the fact that the patient knows themselves to a certain extent. And we are there to advocate for particular approaches. But it doesn't mean that what we say is gospel. Just like what I'm telling you right now, it doesn't mean that you should take this as gospel. It means you should take this information, compare and contrast to what you've heard elsewhere, and start to formulate your own opinion on what you think is best for you. Because ultimately, this comes down to you and your life and what you are wanting and what direction you want to go. But just because a medical doctor, or just because a functional medicine doctor or whoever says do this or do that, you have to make your own decision. And so the biggest issue I have in our modern day and age is that we don't allow enough room for conversation to be had. And so I face it all the time where, I even responded to this doctor on this video and kind of give a bit of a snarky comment because I was just kind of frustrated with it. And she said, "What are your credentials?" Just complete disregarding what I had said or even my points that I had made, because I think that they were good points. She goes right to, "What are your credentials?" As like that's like the barrier of entry, so I can even discuss this with her. And that to me is just not, it's not the right way of going about this, because if I didn't have a clinical doctorate, or if I didn't have any expertise and I was a patient and I was bringing up these same points, you can't just immediately shut somebody off just because they don't have a DR in front of their name, or they don't have a PhD after their name, or whatever the case is. Like, we have to kind of allow for this certain room of discussion to take place, and also appreciate the fact that, she's gone through years and years of schooling, and she has acquired a certain level of knowledge on this particular topic in regards to a pharmaceutical approach to fixing things. And we have to respect that. Like, that is something that definitely needs to be respected. The same is true for somebody who doesn't have any of that education and understands that they want to take a different approach. And maybe they've seen some other evidence that is not inside the conventional lens that has proven to be helpful for them on an antidotal level. Like, all those things matter too. And so we have to kind of be very considerate of those things, and considerate of just pursuing truth. Like, ultimately, we're all trying to pursue truth. We're all trying to get closer to what is the best for society, what is the best for us individually. And I think if we get off point, or we miss the mark on that, it really can lead to this alphabet soup credential competition, where we're just trying to see who has the most credentials. At the end of the day, I think that is missing the point. So getting back to the natural then alternatives to some of the positive benefits of semaglutide, and what are some things that you can do to mimic the positive benefits without having to incur some of the negative side effects. Okay, so the first point was stimulating insulin release. What are the natural approaches to doing this? Okay, so complex carbohydrates, things like legumes, vegetables, one of my favorites is sweet potato. These are great when it comes to a gradual release of glucose into your bloodstream. So that will help to promote more of a steady insulin response, rather than loading it full of something that's more of a simple carbohydrate, like candy or pop or things of that nature, or even breads. Those would be a lot more fast absorbed and cause more of a rapid insulin response. And we want more of a steady, gradual response. Okay. Same is true with fiber, insoluble and soluble fiber, things like leafy greens, berries, beans. They can help to, again, stabilize blood sugar levels and improve insulin sensitivity. Now, this is one of my favorite, and this is also going to touch a couple of different benefits here, but protein. Protein is hugely beneficial when it comes to stabilizing your blood sugar. So things like, quality chicken, that's kind of a sore subject. I'm going to be doing a video here in a little bit about chicken and just animal beef quality and all that kind of stuff, because it is a big topic. But getting quality chicken, quality fish, grass-fed, grass-finished beef, some legumes can be helpful, just in getting your body sufficient levels of protein, because again, this is going to help to stimulate insulin release on a gradual level and prevent rapid blood sugar spikes. There's a bunch of videos online where they show certain foods that you eat and how it will stimulate your blood sugar faster or slower. This is what I'm talking about. Now, certain spices like cinnamon. Cinnamon is a fantastic spice that you can add to your meals, add to your coffee. It can help to stabilize, again, your blood sugar. Fenugreek, again, is something that has been shown and studied to benefit and enhance insulin sensitivity and improve glucose metabolism. Now, something else, this is going to kind of, if you're off a little bit, this is a big conversation, but timing of day, circadian rhythm. Your circadian rhythm is hugely important when it comes to your metabolism. There's studies that show circadian malalignment or misalignment do not or have a correlation to how your insulin responds to your sugar. So your insulin can become less sensitive as the day goes on. And so as you kind of get from that 6 p.m. for most of the daytime workers, as you go from 6 p.m. until midnight, your insulin is going to be less sensitive than it would be first thing in the morning. And so you have to kind of take that in consideration. If you're eating at certain times of day, you can really prevent your blood sugar spikes. And this is one of the tools I use for my clients. This is why we've been able to help a lot of women get off medications and lose a bunch of weight naturally. This is because we help them time their meals so that they're not eating at the wrong times, and so they can actually work with their hormones and get their hormones more balanced so that their blood sugar isn't spiking so much, because an imbalanced blood sugar is one of the primary root causes of imbalanced hormones when it comes to your sex hormones. So you definitely have to take this in consideration when you're trying to get the benefits of this medication, which is to regulate your insulin, or at least to improve insulin sensitivity. Obviously, regular exercise is going to help improve this as well. Exercise is going to especially, strengthening things like your leg muscles, is going to really help to regulate your blood sugar levels. And so, going on a walk after a meal can be very, very helpful to prevent blood sugar spikes and to help to properly utilize that blood sugar that is now in your system. Obviously, stress management is huge. Chronic stress is one of the primary drivers of disease. About 90% of all diseases can have some correlation back to stress. And so stress is, it's mental, it's physical, it's spiritual. It affects us in many different ways. I have a client recently she's been trying to force herself to do a cold shower every morning because she hears it's good for her. Well, I'm just here to tell you, it depends on the person, what forms of stress are appropriate for you. Fasting can be a great benefit, but if you're adding in fasting and restricting your calories and you're stressed at work and you're not getting sufficient nutrients and you're inflamed, now all of a sudden you have a massive issue of stress and oxidative stress, and there are side effects to those kind of interventions or those kind of therapeutic approaches. So you got to be careful. You got to be specifically dosing yourself with the right forms of stress and doing it at the right time, because just like exercise, it may not be appropriate for you at a particular time. You have to kind of incorporate it with everything else to build a firm, strong foundation. Now, again, what some of the other benefits are of this medication, I'm going to kind of wrap this up here, but some of the other benefits are, again, reducing glucagon release, which is essential, again, for blood sugar regulation. A lot of the ways that you do that are what I've already said as far as reducing your refined carbohydrates. You want to make sure you're having complex carbohydrates, have sufficient levels of protein. One thing you can really focus on here is having low glycemic index foods. If you're not familiar with that, there's basically an index of foods that are higher in sugar than others, and you want to try to focus on eating those foods that are lower on the glycemic index. Intermittent fasting can be very, very helpful at controlling this as well. Like I said before, in my program, we help to structure this at the right time with our clients to ensure that they are not adding too much stress and that they're actually getting the benefits of fasting. But that is something that you can do. And obviously sleep is huge. Not sleeping, if you're getting less than 6 hours of sleep on a regular basis, you are greatly increasing your cortisol response, which again affects your blood sugar regulation and it can actually lead to more problems with things like diabetes. And so this is where weight loss, if you're not sleeping, if you're not staying hydrated, if you're not eating sufficient nutrients and making sure your body's getting high levels of fat and protein, you're basically going to have blood sugar regulation issues as time goes on. Now, this is another big one. And one of the other benefits of this medication is slowing down gastric emptying. So what does that mean? So basically, when you eat food, your stomach is taking it in and it's trying to turn it down or break it down so you can actually have this nutrients that are absorbable later on in your small intestine. Well, if you are having issues turning things down and breaking it down, this can be, again, addressed naturally from a functional medicine perspective. You can slow that down by, again, eating fiber-rich foods, eating high levels of protein and fat, healthy fats like avocados, olive oil into your diet. But the biggest thing is just chewing your food. Chew your food. Don't slam it down. Make sure you're chewing it 20, 30 bites each time, especially if it is something like animal protein. Chew it, emulsify it, break it down, get it in your stomach so it's more readily able to absorb and it's not causing this issue with gastric emptying. And the other thing I like to talk about is just limiting your fluid intake. Adding extra space in your stomach with things like water can really be an issue when it comes to digestion. So you definitely want to make sure you're kind of preventing that as well. Now, appetite suppression, this is another thing. This is another benefit of the semaglutide medication. So appetite is very interesting, but there are a lot of factors that go into appetite, why we crave certain things, why we're hungry. Hydration is a big thing. Again, ensuring that you have sufficient levels of fat and protein in your diet, making sure that you're getting sufficient levels of electrolytes with your water and you're actually hydrating your cells. Being mindful when you eat, really paying attention to your food. For me, I'm a Christian. I like to pray before I eat. That really helps to kind of slow me down and calm me down. I don't know if that's by design, if that was actually what God intended for, but for me, that really works to kind of just calm my system so that I can eat food and digest it well. And it really helps me to prevent myself from having an appetite that's kind of getting out of control. It helps to really suppress and control my appetite, but I'm still ensuring that I'm getting sufficient nutrients with each meal. So that's really what, a couple big ones. A last one I would talk about is your gut health. Your gut health is hugely important when it comes to regulating. And I've kind of been talking about this already, but your gut health is really important when it comes to regulating blood sugar management as well. There's a lot of neurotransmitters, specifically serotonin, that is made in your gut. About 90 to 95% of it is produced in your gut. And so if you have poor gut health, you likely have low levels of serotonin, and you likely are not getting that serotonin to your brain, where it helps to, again, control mood, helps to make melatonin for sleep, but it also helps in appetite. And so make sure you're focusing on those components as well. And again, probiotics, prebiotics, postbiotics, like there's all these different types of probiotics. I always tell my clients, let's focus on your nutrition first, focus on your food first. Let's see where your gut is landing, for lack of a better term. And then we'll talk about what kind of probiotics and prebiotics are best for you. But in general, you want to focus on, again, eating nutrient-dense foods, eating foods that are high in fiber, foods that are lower on the glycemic index, more complex carbohydrates, more fats, and more proteins. And your body will start to really prioritize a good microbiome, a good population of bacteria. And whenever we're speeding through our meals, or we're stressed out, drinking a bunch of caffeine, eating on the go, our gut microbiome is now getting disrupted, and it's more likely to produce imbalanced bacteria because we're feeding microbes improperly. And that's really what we're trying to focus on here. But if you want to focus on some nutrients or some supplementation, some ones that I like are chromium, alpha lipoic acid. Those are some, magnesium is a huge one when it comes to helping to regulate blood sugar. Most people are deficient in magnesium. Most people aren't getting sufficient levels of these in their diet. So supplementing with these can be very helpful. Some herbal therapies, things like berberine and cinnamon, again, can help to regulate your blood sugar pretty well. But you want to make sure that you're working with a qualified healthcare practitioner on these types of things, making sure that you're not driving your blood sugar down too low and becoming hypoglycemic or having low blood sugar. And you also want to make sure that if you are on medications like diabetes medications, that you're not interfering with that and driving blood sugar down too low and causing some negative side effects. So again, this is where it's important to work with somebody like myself or a practitioner that you trust, that you can get both sides of the coin to see which route is the best route to go. And again, work with your doctor. Say, I want to do this naturally. How can I do this? How can I get off this medication? If they say you can't, you never will, you may want to work with somebody else. You may want to use that practitioner as just for somebody who's just like, or routine management, but maybe you're wanting to go a little step further. You may want to consider somebody else that can kind of take you that next step. For those of you who are interested in working with somebody like myself, I do work with clients one-on-one. It's one thing that I really enjoy. It's something I really look forward to. It's more like on an application basis, but you can apply. I basically just do a free call with you to see kind of where you are on your health journey, what your kind of goals you're experiencing, or what kind of goals you have, and what direction you'd like to go. I really like to act as a health consultant to my client's doctor. Like, I'm not trying to replace your primary care physician. That's not my job. That's not within my description. My job is to provide an alternative voice, to provide alternative ideas, to help you implement a plan that I've known, that I've seen has worked with thousands of people to this point. And so if that's what you're looking for, you can definitely click the link down in my bio or the description down below, and you can schedule a free call with me. I'd love to talk to you and see if it's something that we can do to work together to help you achieve your goals. But for everybody else, if you've enjoyed this podcast and you've enjoyed this perspective, be sure to share with a friend. This is all, free information. This is my gift to you. I'm not asking of anything in return except for just to share with people who you feel like would benefit from this information, because my main goal is to cause a ripple effect in our world, in our healthcare industry, to start helping people help themselves, to help them overcome these chronic issues. Because I was sick, I was not feeling well. I was able to overcome it through podcasts like this, through people that were educating me. And so I want to be able to do the same thing for people who are looking for that kind of help. And so if you are somebody who wants to get help, definitely reach out. But otherwise, just share with a friend. If you feel like somebody would benefit from this, don't hold back. Share this information. It is something that I think can help a lot of people. But otherwise, I hope that you have a blessed day, and I hope that you come back for the next episode of the Healthy Roots podcast.